Now, the current shutdown is affecting almost all aspects of our lives, and dental work is sadly no exception.
All but emergency treatments have been cancelled. So what does it mean for the industry and, more importantly, I think the dental health of Australians at the moment? Matthew Hopcraft is the CEO of the Victorian branch of the Australian Dental Association. He joins us now. Good morning.
Good morning, Lisa. How's it going?
Good, all things considered. But I guess for dentists, they operate in very enclosed environments. There's a lot of saliva being blown around the place. It's a no-brainer, I guess, that they had to make this tough decision.
Yeah, it's been a very difficult decision for our industry. We've been working really closely at all levels of government and, federally with the Chief Medical Officer, the Health Protection Principal Committee, to come up with some guidelines that protect the public and protect our staff and our members as well. And it's a tough balancing act because we know that dentistry is an essential service. We don't want people to forego necessary dental care. But as you've said, the aerosols that we create in dentistry do pose a risk to our patients and to our staff. So, we've got an important role to play in helping to stop this pandemic as well.
So are any dentists going to continue doing regular checks, or that's just a no-no now?
No. So the new guidelines that came into play at the end of last week have effectively said that we need to defer all routine treatment, and that includes examinations, and that we're really restricted to urgent and emergency care. And there's a strong emphasis on making sure that we still keep maintaining that level of care. We don't want people to have dental problems that would put them potentially into a hospital emergency department and clog up the hospital system at a time when we desperately don't want that to happen. So emergency care is going to continue, but for a lot of our practices, we talk to our members. Probably around 10% of them have already closed their doors, and probably around 50% of them are working at less than 25% capacity from what they normally are. So it's had a huge impact on our industry, and obviously most dental practices are small businesses. They employ a lot of staff, and it's affecting them as it's affecting industries all across Australia.
Yeah, and what about people and their teeth? What should we be doing to make sure we don't end up with emergency situations?
Yeah, well, obviously, we would recommend that people go to the dentist on a regular basis to check their teeth and make sure that things are okay. And when that's out of the equation now for at least the next few months, then it is really, really important that people do take good care of their teeth. So the regular sorts of things, brushing, fluoride toothpaste, flossing your teeth. I think the really critical thing that we're seeing now with people who are going to be home a lot is the tendency to snack a little bit more. When your fridge is there now in your workplace, people are going to snack a lot more, and that really increases the risk of potentially having dental problems. So just take it easy on the snacking, really focus on reducing sugar, lots of water, and really, take care of those teeth, really look after them, because the last thing we want people to be having now is dental problems in the middle of this crisis.
Hey, Matt, just a last question. There's been a lot of discussion about whether we were prepared well enough, whether we had enough gear and equipment and protective means for our frontline health workers. Did you feel that there was enough for dentists to continue operating in those early weeks before they had to stop altogether?
Yeah, there wasn't initially, and we did a lot of work as an association, working with the government to try and secure supply of protective equipment for our members. What we're seeing now with a lot of dentists not working as much as they were previously is that dentists are now wanting to donate that protective equipment to frontline healthcare workers, and we're working through with our members on ways to make sure that other people who desperately need the protective equipment are able to get that now. And the other thing I'd just say is because a lot of practices aren't working at the moment, people might find it difficult to look for a dentist who is providing emergency care if their regular dentist isn't. So we've gone out and mapped all of our members who are currently working. You can find that on our website at adavb.org, and nationally that's been done too at ada.org.au. So if people do have a dental emergency, look for a dentist who's open. Give them a call first. Don't just turn up. Give them a call first. Part of that sort of spatial distancing, get triaged and make sure that you do get care. We will look after people who do have dental emergencies, absolutely.
Matt Hopcraft, thank you.
Thanks, Lisa. Take care.